Dan, and I'm disabled due to a horse riding accident. But I think this is not a good start for today, so let me do it again. I'm Dan and I'm recovering from a horrible tetraplegia thanks to my love of horses. So the question for today, it will be, am I disabled or just a different kind of rider? So let's proceed. 5 years ago, I was living a perfect life, working with horses on 4 continents, from the shores of New Zealand, working with horses with behavioral problems in United Arab Emirates or in South Africa, just living with them in remote places like Mongolia, or doing a little bit weird equestrian sports like polo in UK, tent pegging, or horseback archery at quite a level, I mean world championship. So I will ask you a question. How many of you have fallen from horses in your career? Okay, that's 100% yeah. Yes, so in our world, falling from horses is not a question of if, but more a question of when and how bad you are falling. So yes, in a routine training in an afternoon, a young mare threw me off saddle. I landed on my face with a hyperextension on my head, and I realized from the first moment that I'm completely paralyzed because I couldn't feel nothing below neck, and I couldn't move nothing below neck as well. The diagnosis come quite quickly in the emergency care unit. Tetraplegia to the damage of the spinal cord in the cervical area, which is quite high, C4, C5. I was sent to a palliative care unit, and the doctors said that there are no chances for recovery. I've stayed there for a while, but this is how my tests looked in that moment, actually 3 days after the accident. American Spinal Cord Injury Association impairment scale, I was a grade A complete, and the World Health Organization quality of life scale, it's a 6, a very poor. Actually, these scores were hitting the bottom, as bad as can be. I was facing back then, I'm still having some of them, respiratory difficulties, an excruciating pain, which was also leading to sleep deprivation. I had emotional overstimulation. All of these were leading to anxiety and depression, constipation, which come with the bowel obstruction, which almost killed me in the first month. Normal for people in my condition. I had a urinary catheter, which led to a bladder infection, almost killed me in the second month. So as you can see, tetraparesis is not only a physical impairment, but also a physiological one, coming with a lot of associated problems. One day, I started to move a finger, and in about a week, I started to move a hand. In about a month, it was with the leg, I started to move it. And in 6 months, I was able to turn in bed and to do some moves, at least in bed. More of the time helped, of course. But finally, I managed to stand up, to get into legs, and even to take few steps. I have an interesting story here. Actually, those kinetic therapists were believing in me more than the doctors, more than the neurologists. The doctor said that I have to stay 6 months in bed, actually. They were not thinking about moving me at all, not verticalizing or nothing. These guys started to move my hand and my legs, even though I was feeling nothing. And it worked. Somehow it worked. I ended up standing on my 2 feet and taking some steps. And guess where my first steps led me? Yeah? Back to the place where I was thrown from the saddle. So meet Nazira, the Arabian young mare who did it. She was absolutely not to blame. But in that day, I wanted really to face my fears. So I asked my friends to put me back on horse. It's not a session of hippotherapy, it's just a moment when I really wanted to see if I can get back on the horse. Obviously, I wanted to go back to horses, so I started to go to this equestrian center on and on. I started structured equine assisted therapy and hippotherapy. The first moments were mounting with a hoist and 4 people helping me. I have no videos and pictures because actually everyone was involved in helping me. And I started to work out how it could be better. I worked on bareback and with an adapted saddle. I tried 2 sessions per week and also 6 sessions per week to see which one suits me better. I walked, I trot, I even cantered. I tried longer session of 1 hour or shorter session, 20 minutes. Definitely spasticity decreased, balance and coordination improved, but scientifically I cannot say that I owe my physical recovery to hippotherapy, because in that moment I was doing, and I'm still doing, a lot of exercises. I'm going to the gym, I'm swimming, I'm cycling, I even did some archery, and I'm still trying to do some archery. Actually, 2 years after the accident, I've climbed Mount Kilimanjaro, the top of Africa. I've completed a half triathlon. Yes, it was a disabled style, of course, so it was just for me. Last year in the summer, I cycled 800 miles from the Austrian Alps to the Adriatic Sea in Italy. Yes, I'm not only owing my physical recovery only to horses, but definitely I owe my emotional reset to them. We will talk about this because I think it's the most important part of my recovery. I regain my motivation with them, and most important, my smiles. So, physical recovery. For patients with spinal cord injury, with tetraplegia, yes, it's important, but I would say that the emotional and mental well-being are at least the same, for the same importance. If we think about it, it's almost because actually our emotional status triggers the other. So if we are focusing only on physical recovery and we are omitting at all our emotional and social stability, we will have some, let's say, problems, or anyway, we will not have the positive outcome we are looking for. Let me tell you a story about social reintegration here. Actually, going back to the environment which I cherished, to the equestrian center near horses, I found people which were not looking at me as a disabled. They were asking my opinion. They were looking at me as a professional. They needed me, which was very important for a person in my condition. We are as people with disabilities, we are relying always on someone near us. So one of the problems is that we cannot give something to the others. We are stuck and in need all the time. So this part, I would say, was as important as my emotional recovery and definitely as my physical recovery. I am a veterinarian, which I never worked with scalpels and needles. I was always interested in animal brains, specifically in horses' brains. So I went back to my university and I completed a master program in ethology, human-animal interaction, and a PhD with a thesis on interspecific emotional contagion with focus on horses, of course. So let's go back and talk about this Golden Triad of physical recovery, emotional and mental well-being, and social reintegration, which I would say that is the best approach for patients with spinal cord injury if they are doing equine assisted therapy. It's not a wonder that after 4 years the tests were looking completely different. The spasticity, the impairment scale, it was a grade D on a scale from A to E, which is quite good. And the quality of life was 38, moderate to good. Actually, this one was challenging some of my friends' scores, which were doing the test with me in the same time, and some of them were lower than this. So what can you ask more? Okay, let's go to some conclusions. First, trust in neuroplasticity. So trust in the ability of your nervous system to create neural pathways. Actually, the difference between you, let's say normal people, and an amazing athlete like a tennis player or a musician like a violinist, the difference is the same as it is between me and, let's say, you. So what they are doing with everyday exercises, they are improving these neural pathways, yes, in a way that we cannot imagine doing it. If our life would depend now on playing on violin, probably we will die all, or maybe some of you not. Yes, what I'm doing today, definitely after 4 years, is improving by neuroplasticity. So I had, and it's a scientific fact, that the preparation, recovery, of my nervous system, it lasts about 1.5 years, 2 years. After that is definitely neuroplasticity. So what I'm doing now is I'm trying to play a violin, exercising as many hours per day I can, and probably for the rest of my life. So, following that, exercise is useless if you can't find motivation and purpose in what you are doing. If you need 3-4 hours exercise per day for decades, is definitely that without motivation and purpose, you will not doing it. And here we go back to our horses. They can really provide the purpose and the motivation. And let's not forget this when we are taking people for equine assisted services, equine assisted therapy, hippotherapy, or whatever. And equine assisted therapy is not about riding horses. It's not about getting people on horseback. It's first about the connection and bonding, about emotional support, self-confidence, and mental health, and only then about physical recovery. I know that you know this. In this part of the world, you know this. But I came from a part of the world, which is Eastern Europe, where I've seen too many times, not only kids, but even adults, just throwing the saddle on bareback, whatever, and trying to do something which was resembling hippotherapy. Of course, no results. Patients leaving after 2-3 weeks, 1 month, and you can imagine that you cannot ask to be seriously considered as an alternative therapy if you have no results. So let's not forget about the Golden Triad, yes? Emotional stability, social reintegration, and physical recovery. Because these horses are the perfect partners for providing us with purpose, help with the means, and regaining our spirit. Even sometimes can be rough. Don't worry, things like that happen to me about once a week. So I have bruises. I have lots of bruises, but believe me, these bruises are much better than the bad bruises. So, the further directions would be to establish some protocols. How to blend actually the equine assisted therapy, meaning just being with horses, grooming them, touching them, staying with them, with the hippotherapy, which one is actually better, if you can do both or only one, how many times per week. I tried twice per week, I tried even once per week, I tried 6 times per week. Believe me, the worst is 1 per week, because actually you lost the focus, you lost the connection with the horses, and some kinetotherapists, some doctors, some physicians would argue that 6 times a week increase spasticity. I didn't feel that, but it's an empirical thing. Yeah, it's not scientific fact. Maybe we should prove how it's okay. How long you should stay in the saddle. It is enough 20 minutes. Have you do it for 1 hour? Again, arguing if bareback or an adapted saddle. Yes, I would say bareback, but again, it would be nice to do a scientific study about this. And very interesting, let's measure the horse-human connection. If it happens, how fast it happens, how long it lasts. Again, if you are doing it only once per week, probably you will lost the connection. And very important, I would say, let's see if it's beneficial for horses as well. Because we tend, again, I'm speaking about that part of the world in which I live now, we tend to use horses as tools, not as partners, and we have to stop this and reconsider this relationship. Actually, my main interest is not in equine assisted therapy, is in this emotional contagion from horses to humans to horses. And we have the means to measure emotional arousal in horses and in humans. And we are really able now, doing proper study designs, of course, to say if we have this kind of emotional connection, if we have different kind of emotional arousal, if we have fear, if we have anxiety, also in humans or in horses. This is the way where I'm heading to, and hopefully future researches will clear up the sky on this topic. I will leave you with the last couple of minutes of a movie, a documentary movie, which was made by an independent company about my recovery. You should notice the smile, yeah?